If your patient is declining, seconds matter. Let's make the Glasgow Coma Scale, or GCS scale, something you can do in your sleep. So what is GCS? Well, GCS is a scale that we use to track consciousness in patients throughout either their pre-hospital stay or even during their hospital stay. It's a way to assess how awake they are, how responsive they are to all of our questions, right? And we can trend patients. So if someone comes in as a full 15 or the max of a 15 and they start kind of going down the scale to a 13, 12, that's how we see that our patients are declining in real time. So what do the numbers mean? Well, we're going to use a set of 3 different values to calculate a total number, and that total number is going to tell us how well our patient's doing. Now, every patient has a baseline, and you and me, if we're watching this video, are probably a 15, right? A 15 just means that you are fully alert and oriented, and you are responding to everything that you need to around yourself. As you start declining on that scale, going down to 13 or 11, you start getting more and more towards the unconscious scale, where less than 8 is typically almost an unconscious patient. So the GCS scale consists of 3 different categories that we total up to 15. The first one is going to be eyes, the second one is going to be your verbal response, and the third one is going to be your motor response. So what's our first scale? Well, it's going to be eyes. So eyes is scaled on a 1 to 4 scale. How do you remember it's only 4? Well, eyes is 4 letters, so it's only 4 scores that you can possibly get. A 4 out of 4 is going to be spontaneous. What does that mean? Well, if I walk into the room and the patient looks up at me, that's a spontaneous eye score. As we go down the list, it gets a little bit more complicated. The next one is going to be to voice. So that's a 3 out of 4 on the eye scale. If I talk to you and you look up at me, that means that you're alert to voice. The next one is going to be a 2 out of 4 on the eye scale, and that's going to be alert to pain. If I have to sternal rub you or kind of shake you awake, that's an alert to pain score, and that's going to be a 2 out of 4. And if you don't respond to anything at all with your eyes, that's going to be a number 1. You're going to get a 1 out of 4. Now, why not a 0? Well, that's just how the scale's set. The next category we're going to be talking about is your verbal scale. Now, verbal scaled from 1 to 5. That's how we score it. And the way that you remember that verbal is out of 5 is that verbal starts with a V, and V just happens to be the Roman numeral for 5. So that way you know 1 to 5 is going to be your verbal scale. So what's a 5 out of 5 for verbal? Well, that's going to be people who are oriented. If you know where you are, who you are, and what you're doing, you're an oriented patient and you're a 5 out of 5 on the verbal scale. One step down from that is going to be your confused patients. That's going to be a 4 out of 5. So anytime a patient isn't super duper sure, but they're still responding to you appropriately, that was going to be a 4 out of 5 or a confused patient. A 3 out of 5 is going to be an inappropriate word, right? So if I'm asking you what your favorite color is and you're telling me salad is your favorite color, 3 out of 5. A step down from that is going to be a 2 out of 5 or incomprehensible sounds. If you're just mumbling, you can't actually produce a word, that's a 2 out of 5. And what if you don't produce any words at all and you're not doing anything verbally? Well, that's going to be a 1 out of 5, lowest tier that we can get. The last category that we have is your motor responses. Now, motor is scaled from 1 to 6. And the way that I know that it's 1 to 6, well, motor happens to be 6 letters. And I know verbal is also 6 letters, remember the V. So motor is going to be 1 to 6 because 6 letters. So what's a perfect motor scale? Well, 6 out of 6 is going to be when they obey commands. If I ask you to shake my hand or ask you to push a button, do something like that, and you can follow all these commands, that is a 6 out of 6. A 5 out of 6 is actually kind of an interesting one. It's called localizing pain. Now, what does that mean? Well, if I pinch your ear and you kind of wince to that actual pinch, that is going to be a 5 out of 6. A 4 out of 6 is going to be called withdrawal from pain. Now, what does that mean? Well, if I pinch your knee and you move your head, that's going to be a 4. A 3 and a 2 on the motor scale are kind of interesting. Now, the first one is called decorticate. What does that mean? Well, decorticate means that you're starting to curl into the core. It's kind of a neurologic response to trauma or something in the brain is not going right. Now, how do we know the difference between decorticate, which is a 3 out of 5, or pardon me, a 3 out of 6, and then deceribate, which is a 2 out of 6, which is a little bit worse. Decorticate, the way I remember it, is that you curl towards the core, right? Decorticate, the core. So you start like curling, your body moves inwards, your feet moves inwards, and everything just kind of curls inward. The cerebit is where you curl outward. Your arms go out, your legs go out, and it's away from the core of the body. So decorticate to decor. And what's a 1 out of 6? It's nothing. If you don't do anything motor-wise at all, no movement, that's gonna be a 1 out of 6. A GCS scale is something that's going to come up over and over and over as you go through either your medical training or just through medicine in general, through nursing, through RT, whatever. You have to be able to pull up a GCS scale because it's super duper important for your rapid response patients. Now, how do we do it quickly? Well, we just do an EVM. We go eyes, motor, verbal, and you just add up the scores, and whatever they get is what they get. It can be a little bit subjective, but for the most part, as long as you follow these steps that we've gone through and you look at the patient and do them one by one, you will get a pretty consistent GCS score for that patient. A little tip is that whenever patients are intubated and sedated and stuff like that, their GCS can change quite a bit based on the sedation that they have currently going. So remember to caveat that with, hey, my patient's a GCS of 3, but I have them intubated and sedated. It's to be expected. It's what I want the patient to be at that time. Keeping a consistent and trended GCS score helps see emergencies before they even happen sometimes. So make sure to keep up with that GCS score and keep the team updated as well. If this helped you feel a little bit more confident in neuro checks and GCS scores with patients, please give a like and subscribe or a follow for more tips that you'll use actually at the bedside. Y'all have a great day. Thank you very much.